Hello and welcome. Today, we're diving deep into a common yet often painful condition, bladder calculi, also known as bladder stones. We'll explore what they are, why they form, how they're diagnosed, and what can be done to treat and prevent them. So, buckle up as we navigate the urinary system and understand this fascinating and sometimes uncomfortable ailment. Now let's talk about the causes or etiology of bladder stones. These stones don't just spontaneously appear. In most cases, they form when your bladder doesn't empty completely. This retained urine can concentrate, allowing minerals like calcium, oxalate, phosphate, and uric acid to crystallize. Several factors can contribute to incomplete bladder emptying. These include an enlarged prostate in men, which can obstruct the urethra. Neurogenic bladder, a condition where nerve damage interferes with bladder control, can also prevent complete emptying. Other potential causes include bladder infections, kidney stones that travel down the ureters and become trapped in the bladder, and even medical devices like catheters that stay in the bladder for extended periods. Rarely, metabolic disorders can also contribute to stone formation. To understand bladder calculi, we need to delve into the pathophysiology, or how the disease develops. As we discussed, the primary problem is incomplete bladder emptying. When urine remains in the bladder for extended periods, it becomes more concentrated with minerals. These minerals then start to clump together, forming tiny crystals. Over time, these crystals attract more minerals and grow larger, eventually forming a bladder stone. The stone's size, shape, and composition depend on the specific minerals involved and the duration it remains in the bladder. The stone's presence irritates the bladder lining, causing inflammation and discomfort. If the stone obstructs the flow of urine, it can lead to more serious complications like bladder infections and even kidney damage. Let's briefly touch on the epidemiology of bladder calculi. While bladder stones can occur in both men and women, they are more common in men, particularly older men, due to the higher incidence of enlarged prostates. The prevalence also varies depending on geographic location and dietary habits. Regions with higher rates of dehydration or diets rich in certain minerals may see a greater number of cases. Although less common in children, bladder stones can occur, often associated with underlying metabolic or anatomical abnormalities. Now, what are the signs and symptoms of bladder calculi? The symptoms can vary depending on the size and location of the stone. Some people might not experience any symptoms at all, especially if the stone is small. However, common symptoms include lower abdominal pain, difficulty urinating, a frequent urge to urinate, painful urination, blood in the urine, and a burning sensation during urination. Men may also experience pain in the penis or testicles. If a bladder stone causes a urinary tract infection, symptoms like fever, chills, and nausea may also be present. So how are bladder stones diagnosed? The first step is usually a thorough physical exam and a review of your medical history. A urine test is typically performed to look for blood, bacteria, and crystals. However, imaging studies are crucial for confirming the diagnosis. A common imaging technique is a CT scan of the abdomen and pelvis, which can easily detect even small stones. An X-ray of the abdomen can also be used, although it may not be as sensitive as a CT scan for detecting all types of stones. Sometimes, a bladder ultrasound or cystoscopy, where a small camera is inserted into the bladder through the urethra, may be necessary to visualize the stones directly. While bladder stones aren't typically categorized into strict types, they are often classified based on their chemical composition. The most common types include calcium oxalate stones, uric acid stones, struvites often associated with infections, and calcium phosphate stones. Knowing the composition of the stone can help guide treatment and prevention strategies. Now, let's discuss treatment and management options. The approach depends on the size, location, and composition of the stone, as well as the patient's overall health. Small stones might pass on their own with increased fluid intake and pain relievers. Alpha blockers, medications that relax the muscles of the urethra and prostate, can also help facilitate stone passage in some cases. However, larger stones usually require intervention. Cystolitholapaxy is a common procedure where the stone is broken into smaller pieces using a laser or ultrasound, and then the fragments are removed through the urethra. In some cases, open surgery might be necessary to remove very large or complex stones. Medication may also be prescribed to treat underlying conditions that contribute to stone formation, such as uric acid stones. Prevention is key to avoiding future bladder stone problems. The cornerstone of prevention is staying well hydrated by drinking plenty of fluids throughout the day. Dietary modifications can also be helpful, depending on the type of stone you're prone to. For example, if you form calcium oxalate stones, your doctor might recommend limiting foods high in oxalates. If you have uric acid stones, reducing your intake of purine-rich foods like red meat and seafood can be beneficial. Addressing any underlying conditions that contribute to incomplete bladder emptying, such as an enlarged prostate, is also crucial. Regular follow-up with your doctor is important to monitor for any recurrence of bladder stones. Finally, let's look at the prognosis and any recent advances in the field. The prognosis for bladder stones is generally good, especially with prompt diagnosis and treatment. However, recurrence is possible, highlighting the importance of preventive measures. Recent research is focusing on developing more effective and less invasive techniques for stone removal, such as advanced laser technologies. Researchers are also exploring new medications to prevent stone formation by targeting specific metabolic pathways. Understanding the genetic factors that may predispose some individuals to stone formation is another area of ongoing research. Thank you for joining us on this exploration of bladder calculi. Remember, if you experience any of the symptoms we discussed, it's essential to seek medical attention promptly. Early diagnosis and treatment can prevent complications and improve your overall well-being.